Are you struggling with shin splints that just won't go away in Ironman training? Whether you're deep into your Ironman training or just setting out, shin splints can derail your progress and stop you from crossing that finish line. But what if I told you there's a way to fix them, stay strong and keep progressing in your Ironman training? Today in this video I'm going to break down exactly how to manage and prevent shin splints from derailing your Ironman training so you can reach peak performance and hear the words, "You are an Ironman." So if you are new to the channel, my name's Joe and this is George. We're both triathletes and physiotherapists, and we've made it our mission to help triathletes in their Ironman training to prevent injuries and take their performance to the next level so they can cross that Ironman finish line in the time that they're capable of. So if you are new to the channel, make sure you hit that like and subscribe button. So what exactly are shin splints? So medial tibial stress syndrome, better known as shin splints, is a bone stress injury where the medial part of your tibia, so that's basically the inside of your shin bone, and this reacts to excess training load, and the pain comes from micro damage accumulating faster than the body can repair it. So medial tibial stress syndrome is particularly common in Ironman triathletes. That's because the volume, frequency and intensity of training is very high, and it can start to build quickly depending on where you're at in your training block. Now let's talk about risk factors. So having a high BMI, increasing your training load too quickly, and having weak glutes have all been shown to increase your risk of developing medial tibial stress syndrome. And like I've touched on, possibly the biggest risk factor for developing medial tibial stress syndrome is training error. For example, increasing your mileage too quickly or increasing the frequency of your training increases risk of shin splints. But also adding in additional hill sprint sessions can be a risk factor too, because uphill running can place lots of load on your calf muscles. So it's really important having a look at your training and seeing if you've added in or changed anything too quickly. It's also important to consider your footwear. If you've recently changed shoe or switched to a more minimalist shoe, has been shown to increase your risk of medial tibial stress syndrome. So what are the major signs and symptoms? So the biggest clue is posterior medial tibial tenderness, which runs for more than 5 centimeters. This will be a diffuse pain that's spread around the middle of your shin. And also the pain will worsen on activity and should improve with rest. If you're getting a combination of these symptoms, then it's very likely you're dealing with medial tibial stress syndrome. But if you are in doubt, it's really important you go and get an assessment with a healthcare professional, just so they can double check and potentially rule out anything that might be more concerning. So how do we treat medial tibial stress syndrome? First of all, optimal loading is key. Because medial tibial stress syndrome is a bony injury, it's vital that we're exercising in a pain-free range during our workouts and after our workouts. So that means you need to find a pain-free level of activity for a couple of weeks until the symptoms begin to settle. So it's very likely that running at the moment can be aggravating your pain. So I really recommend that you switch out your running and focus more on your swim and bike sessions. Because again, this is a bone stress injury, we need to be working in that pain-free zone until the pain levels begin to improve. I know it's frustrating, especially in Ironman prep. You might feel like you're starting to fall behind and want to try and push through the pain anyway. I'd really recommend not to do that. Focus and double down on your swim and bike sessions and try and overcome any weaknesses that you have in these disciplines. And don't forget, like I mentioned in all these videos, strength training is absolutely key here. So you need to be strengthening the major muscle groups in your legs and also loading that bone optimally and safely. So in rehabbing medial tibial stress syndrome, it's vital to focus on the calf complex because this area plays a key role in shock absorption around the foot and ankle. But you do also need to be working other major muscle groups, so focusing on building strength in the glutes, quads and hamstrings. So realistically, you need to be working on a well-rounded lower limb strength conditioning program. The main question you probably want to know is, when can you return to running? So I'm going to give you a checklist to work through so you'll know when it's safe to return to running. You should be able to walk for 30 minutes pain-free. You shouldn't be getting any swelling or night pain. And then you need to be passing some basic impact testing. You need to be able to jog on the spot for 1 minute, and you need to be able to hop on both legs pain-free for 10 repetitions. If you can do all of that pain-free, I'd say it's safe for you to return to running, but you need to be building up your mileage in a smart and controlled way and following pain as a guide. So shin splints can be really frustrating, but with the right approach and management, you can get things to settle down and get back to full Ironman training in no time. But if you are struggling with shin splints, or you want more advice and guidance on how you can prevent injuries from derailing your Ironman training, you can join our free 14-day online Cross the Finish Line workshop. In this workshop, me and George break down the exact strategies that we used as physios in Ironman training to prevent injuries and take our performance to the next level. And we're going to show you exactly how you can take these strategies and implement them into your own training. So it is a free workshop. If you just click the link in the description, you'll get all of the information that you need. So I hope you found this video helpful. Make sure you keep an eye out for more videos and hit that like and subscribe button. Thank you very much.